A very good evening to everyone and happy Dasara to all of you. It's a very good occasion to meet all of you on this auspicious day. So we will have a new session, new remedy in today's session. That is the Gelsemium. In fact, yesterday we have discussed the Ethuja synapium and little bit close to the Ethuja synapium is the Gelsemium regarding the drowsy state of the uh, patient, which is very common with the Gelsemium, both the remedies having thirstlessness, but action varies. Specifically, it is lactose intolerance, milk intolerance, which we have seen in Ethusia synapium. Here, in Gelsemium, it is the lack of muscular coordination, the paralytic state, the most motor paralysis, weakness, exhaustion, torpor state, which is quite common with this Gelsemium. So before going to the Allen's keynotes, we'll just have two important cases in my practice. A way back, there was a patient who was brought to me nearly about 30 years of age. He had a malarial viral typhoid complex, and he was nearly about in 1 month he was in bed with continuous allopathic medication. He was prostrated so much that when he was brought to me to see, he was supported by two persons, and he asked me, he cannot sit on the chair. He must be able to lie down on clinical examination table. And whole case was taken in that specific state. Then when I was discussing with him, he was little bit drowsy at that time, giving the answers, but in a drowsy state, prostrated state. When I used to ask him certain things, many times he was in a confused state. If I asked him, what is your name? He never used to answer immediately. He used to answer with little bit confusion. Then again I have to ask the question, and then he used to answer. He was Then whole case was revolving around that this has started after the fever. So I asked what how was the fever? And fever was very typical. He said that in Marathi, he said one sentence that Dr. Mala पाठी कडून थंडी यायची. The chill begins in back. That was very typical he has used. And then I used to suffer a lot and I used to get the heat. And during whole episode, I got so frustrated thereafter. I could not able to wake up or sit, not able to. Absolutely, that there was tremendous weakness in me after that. And that was his state, and he was continuously admitted in the hospital with lot of varieties of antibiotics, anti-malarials, antivirals, many things they have provided along with the steroids. And he was not recovering. They said that now fever has stopped, but the weakness was so marked that he was not able to come out of that weakness. That was very typical with him. The thirstlessness was characteristic whole episode. He was thirstless, not able to have thirst. And when I asked regarding many things, the confusion happens to be there. So that was the state of the person. So from my point of view, I asked, why don't you sit? He says, I could not. If I want to lift that glass, I could not. I feel that I want to take that glass and I want to take fluid or etc. But it is not possible. Not possible to hold that. As if my muscles are refusing. I feel internally, yes, I should. And these people who are there with me, they said that I'm deceiving them. It's not the condition. I could not. I don't have that strength. And that was clear-cut case of Gelsemium. So I have started him with Gelsemium, the 3 doses in high potency, 1 potency. And after giving 3 doses of 1 potency, I asked him to meet me every day. And I never have to repeat. Next day he was much fresh. He was able to sit after good sleep all night. Next day he sat down and he was having the strength. Then again, after one day when he was returned, there was no need to support him. The recovery was so fast after giving the Gelsemium that he recovered fantastically. There was no need to repeat the medicine in that case. So this is the Gelsemium state which you can observe in patients, and most torpor, exhausted, prostrated, with drowsiness, with weakness, dullness. That is the typical state of the Gelsemium. And another case, who was again a young fellow, unmarried, 25 years back. It was just 3 years, 4 years back. I think it was just before the COVID. That patient was there with me, and he came to me. He was diagnosed 1 month back, a case of myasthenia gravis, and he was on allopathic medicine, and he was asked to go for thymectomy. And he said, "Sir, can I prevent my disorder, or shall I stop these steroids which were prescribed for me with the help of homeopathy?" And he said that with 40 milligrams of Visolan, yeah, he was not completely recovered. Many times I wakes up and I have to open my eyes like this. Then he said that many times I get double vision whenever I'm on my bike. Many times I have to stop. I have to open the eyes, and I start getting double vision because the lids were coming down. And this state is there since last 1 month. I could not do my job. He was medical representative, and he was not able to go for the job because of this, and he was frustrated. So is it possible? And it was a recent case. It was not a long standing case. It was a recent case. Within a 1 month, he came for the homeopathy. And even after 40 milligrams of steroids, the problem was there. He started with 40, 60 milligram, then reduced to 40, and they asked that don't reduce the dose because still you are not good. And then in that case also, I took whole case, and I found that the same thing, that the muscles in coordination was there. There is a falling of leads that was very characteristic. The patient was thirsty, thirstless. Patient was drowsy, dull. All those things were present. And with this, he was presented. Asked just history, whether there was any incidence of a fever or any influenza or any dengue or anything. And he said that 2 months back, 3 months back, he suffered from the flu, and thereafter this has started, and he has treated with allopathy. So again, I have given him Gelsemium in the high potency over here. Again, 1 m, because it was neurological problem. I wanted result more at the deep level. So I have given Gelsemium 1 m, again 3 doses, and I was following him. And within span of 1 month, he recovered so nicely that even after reducing doses of steroids to 10 milligram, he was not getting the diplopia, even the falling of leads. And thereafter, he continued medicines for 1 month, and I was observing him. I increased the potency of the CM with Gelsemium only, because it is a deep acting remedy. 30 days action is there with Gelsemium. Even though it is very acute pace, having the acute pace, subacute pace, this remedy is also useful for chronic cases. And he recovered even after I have stopped his steroids. There was no recurrence after a year. So these two cases were very much illustrating about the action of Gelsemium. Let us open the Allen's keynotes and find it out what Allen wants to say about the Gelsemium. Gelsemium, it is Allogestmin family, is Logenaceae. For the children, young people, especially women of a nervous hysterical temperament. This is the remedy useful for young people. This is very important, and I have seen that many times it is the remedy for young people. Very occasionally, in old people where the pulse is slow, uh, the cardiac changes happens to be there. Then this remedy is useful in old people. Otherwise, it is very good remedy, subacute remedy. This remedy is very good for influenza, change of weather, and influenza where the toxic state starts appearing. So after econoid, belladonna, ferrum 4 stages have been covered and patient becoming little bit drowsy and toxic, that state defines the Gelsemium. Complete relaxation and prostration of whole muscular system with entire motor paralysis. And this is very specific with Gelsemium. Motor paralysis. The muscles are not having strength to do any activity. They become so prostrated, so weak, they, it is not possible for them to come out. Very excitable, irritable, sensitive. See the state of mind. They are excitable personalities, irritable personalities, sensitive. So it itself defined that is that they are young. For the nervous affections of onanists of both sexes, this is the they dwells on the sex. They are onanist, having nervous affections, nerves on the tip of their nose, and both things, either nerve irritation is there or either nerve paralysis is there. Both level this remedy is useful, like caliphosphoricum. Caliphos is also a remedy where there is a nervous excitability as well as nervous depression. Very close to the caliphosphoricum, Gelsemium state is there. Then see what he says. What are the causative factors? Bad effects from pride. This is very typical. Nervous diarrhea, very specific. Argentum nitricum gelsemium. Bad effects of pride, fear, exciting news, and sudden emotions. Suddenly causes to get affected, and their affection generally happens at two levels, either neuromuscular level, either at the GI tract, producing a diarrhea. In ignatia, similar causes are there, but in ignatia, it goes into the directly hysterical state more commonly in ignatia. And there is from pleasant surprise, if the patient becomes from pleasant surprise, he becomes excitable or there is an excitement, then coffee is the remedy. See, these differences one has to understand. Coffee is very useful remedy in such types of excitement. If excitement causing the palpitation, it is calcareous. So you have to understand what is the cause and what is the effect. Both you have to look for, then you can get a right remedy over there. Fear of death, like arsenic album, with and utter lack of courage. So these are people who don't have courage, cowardice, don't have strength. That is more important. Muscular, they don't have strength. The anticipation of any unusual ordeal, preparing for church, theater, or to meet an engagement, brings on diarrhea. So this is nervous diarrhea. Whenever they have to go somewhere, immediately thought comes and they get the gastrocolic reflex, which gets stimulated and they get diarrhea, like argentum nitricum. The stage fright, the nervous dread of appearing in public, like argentum nitricum, and these are things which you can commonly see with gelsemium and argentum nitricum. Both of them have a nervous diarrhea. Lycopodium is also having a stage fright, but Lycopodium, when goes on the stage, he performs. He's a good performer. Only he lacked the courage while going to the stage. General depression from heat of sun and summer, the most important modality. They loses the strength. They don't want to do anything during the hot summer weather. This is very important. They are frustrated. There are two modalities. Summer weather also aggravates and also damp weather also aggravates. Both modalities are present in Gelsemium. Weakness and trembling. Weakness and trembling is so much that weakness you can find the tongue is trembling, the hands, legs, and entire body is trembling. If they are walking, that gait, as if the person was going to fall down. That typical trembling which you can find it out with these personalities. So tremors are very characteristic with Gelsemium because of the weakness and frustration which happens to be there. They have to be quiet and to be let alone. So they don't want to get disturbed. They want a quietness. They don't want to get disturbed. They want to be alone. Does not wish to speak or have anyone near her, even if the person be a silent. So they don't want anyone near them. They just want to lie down and remain silent, peaceful, because the disturbance immediately causes aggravation over there. Even they don't want company of anyone like Ignatia. Even the person is silent, he never likes. He wants alone. That is very typical with the Gelsemium state. Then vertigo. Vertigo is very typical migraine headache of the Gelsemium, acute migraine headache. It is wonderful remedy. It starts with vertigo, and vertigo starts in occiput. Headache also starts in occiput. That is the characteristic of Gelsemium. Vertigo spreading from occiput like Cilicia. In Cilicia, it is vertigo as well as headache, which starts over there and then it comes up and then it settles over either one eye is Cilicia. Then in specifically on right eye it is sanguinea, specifically on left eye it is Weigelia. If it remains to be there at the vertex, the Gelsemium with the drowsy state, with diplopia, dim vision, loss of sight, the person seems intoxicated when trying to move. That is very typical. They feel as if they have consumed something. They are intoxicated. Intoxication feeling is there whenever they walks, and that characteristic which you can observe with these people. Children, fear of falling, grasp the crib or seize the nurse. There is very typical, like borax, like sanicula, they grabs the cradle and they fears they will fall down. That is very typical with them. Headache, see the headache. Headache is very typical of migraine, preceded by blindness like chylomicromicum and ameliorated by profuse urination. Underline this. This is the characteristic which you can get many patients of Gelsemium. So Gelsemium, it is very easily you can find it out if the state matches the dull, dizzy, drowsy, thirstless, with prostrated, with motor paralysis, with a typical occipital headache, with that is characteristic of this remedy. Lack of muscular coordination given in bold, and that has a significance. Lack of muscular coordination, that if he wants to lift something, not possible. Confused, when you ask the question, they look confused, toxic. Muscles refuse to obey the will, and that is very, very specific of this remedy. Then the headache beginning in cervical spine, pains extends over the head, causing bursting sensation in forehead. So it used to produce very severe bursting headache, causing a bursting sensation in forehead and eyeballs, as if eyeballs will open up, like sanguinary cilicia. Begins in the same way, but semilateral. In sanguinary, it is semilateral. In cilicia, it is semilateral. In spigelia, it is semilateral. Here, it involves the whole head, Gelsemium. Aggravation by mental exertion. So, slightest mental exertion causes the headache. Aggravation from smoking, another important characteristic. Aggravation because of heat of sun and aggravation by heat lying with head low. The head is kept low, they get the headache. See, these things, the modalities, the causative modalities, the concomitants, all things should match, and then you can get very specific remedy. And that's why it is necessary to go through Allen again and again. Then it remains in your mind. When patient is there in front of you, you can catch the remedy. Sensation of band around the head above the eyes, like carbolic acid, the sulfur. So there is a band around the eyes as if it has tied up. That sensation is there typical with this remedy. And last, that is the scalp is sore to touch. And he said, doctor, my scalp is paining. He presses over there and this is painful. Very difficult. Fears that unless unmoved, heart will cease beating. See, the patient always wants to move. Unless he moves, fear that unless unmoved, heart will stop beating. And the exactly opposite modality is there. Fears it would cease beating if she moves. So if slightest movement is there, heart will stop. That is digitalis. But if patient stops moving, he feels that heart will stop. See the opposite poles of modalities in Gelsemium and the digitalis. Slow pulse of old age. That's what I want to say. It is slow pulse, weak pulse of old age, torpor state, which you can see. Great heaviness of eyelids cannot keep them open, typical of myasthenia gravis, drooping of lids, causticum, graphitis, sepia, these are remedy. But Gelsemium, when toxicity is there, when drowsy state is there, when thirstlessness is there, when nervous prostration is there, Gelsemium always works. Then the fever, chill without thirst. Thirstlessness is very characteristic. Chill stage without thirst, especially chill along the spine. So it is along the spine, running up and down the back in a rapid wave-like succession from sacrum to occiput. And this is what the patient talks. Doctor पाठीकडून थंडी येते. This is sentence with which they talk, they expresses. So chill always starts, begins in back and it runs up and down, and then patient gets fever after chill. That state is very typical of Gelsemium. Generally, such types of fevers are influenza fevers. So it is a very important remedy in influenza. It is very good remedy in early stages of typhoid fever. It is very good remedy even in malaria-like fever. So this remedy is a wonderful remedy. And even in boric, he has mentioned it is good remedy for pellagra. Pellagra is nothing but vitamin D3 niacin deficiency. So that is also one of the important clinical indication mentioned by boric in his book. So this is what the gelsemium is there. So gelsemium you can catch very easily, and many in acute influenzas. Always think of this remedy when body ache is severe, when backache is severe, the chill begins in back, associated with headache, occipital headache, with thirstlessness, with drowsiness. This remedy is wonderful remedy. See, aconite before the localization takes place in the inflammatory stage of fever where localization takes place before localization takes place, so pain is the characteristic, aconite is the remedy. Then ferrum first when it starts becoming congested, when congestion is full form, belladonna is the remedy. And when after congestion patient is becoming little bit dull, drowsy, brownish in appearance, or what you can say muddy in appearance, the state, stupor state going on, then gelsemium state comes. So you have to catch this. You have to see to the patient and catch this. Then you can locate it very easily. Relations, compare the bacteria in threatening typhoid fever. So what he's saying, compare the bacteria in threatening typhoid fever. Threatening means होऊ घातलेला, which is going to start, not it entered. Before bacteria, this is good remedy. Bacteria follows well the gelsemium. That is given in the boric remedy. That is a very good remedy for that follows well. Even ipecac is a remedy which follows well. Ipecac in dumb egg fever is like intermittent fever, influenza fever after suppression by quinine. So ipecac after ipecac this after what's after the gelsemium you can go for ipecac. Both remedies are touchless, but in ipecac nausea is associated. Ipecac the tongue is absolutely clean coated. So these things which you can catch over there very easily. These are very important things. And lastly, the modality, the general modality. Aggravation during damp weather, before thunderstorm, mental emotions or excitement that already we have seen. Bad news, tobacco smoking, that is another characteristic. When thinking of his elements like oxalic acid, this is very important remedy. When spoken to of his loss, financial loss, that these people they get affected, they get a nervous diarrhea, they get affected at neuromuscular level. And these are very specific modalities. And even hot summer weather, it aggravates the gelsemium patient. So this is a wonderful remedy in day-to-day homeopathic practice. Whenever the season changes, this remedy is very important remedy, specifically in fevers where chill begins in back, runs up and down, associated with severe headache. Headache starts with blindness, settles over whole head, with drowsy state, thirstlessness. This remedy is the remedy. Lack of muscular coordination, don't forget, muscles refuse to obey the will. Headache better by profuse urination, another important characteristic. So one should not forget the gelsemium state. If you are able to catch the state of gelsemium person, it's quite easy to reach to the remedy. So that's all for today. If any query is there, we'll have a discussion. Otherwise, I'm explaining it in English. I'm poor in Hindi. I could not explain the things in Hindi, but I'm explaining them in Marathi, English also. That's why there is no need that to talk in Hindi every time. So even though it doesn't matter, I'm explaining it same thing in English also. Okay. Any other query if it is there? Otherwise, we'll meet tomorrow again with another new remedy and we'll continue with the series. 2 days it was not possible to have philosophy session, but tomorrow definitely I will go for the philosophy session. Thanks a lot for attending session. We'll meet again tomorrow. Good night.